Do you need a TB vaccine if you live in an endemic area? Living in an area where tuberculosis is common means you might be more exposed to the bacteria that cause the disease. Tuberculosis is a bacterial infection that mainly affects the lungs but can also spread to other parts of the body. The most widely used vaccine for tuberculosis is the Bacillus calmette-guerin, or BCG vaccine. It is mainly given in countries where tuberculosis is very common. The BCG vaccine is good at preventing severe forms of tuberculosis in children, like meningitis or widespread disease, but it is less effective in preventing the most common form in adults, which is pulmonary tuberculosis. If you live in an endemic area, especially as an adult or teenager, you might wonder if you should get vaccinated. The current BCG vaccine does not reliably stop the transmission of pulmonary tuberculosis, which is the main way the disease spreads among adults. Because of this, researchers are working on new vaccines that could offer better protection for older populations. One promising candidate is the M70-AS01E vaccine, which is being tested to see if it can prevent tuberculosis in adults and teenagers more effectively. Deciding whether to get vaccinated depends on your personal risk factors and should be discussed with a healthcare professional. Public health programs in high-risk areas often include vaccination efforts to help control the spread of tuberculosis. However, the success of these programs can vary based on the vaccine used and the local prevalence of the disease. It is important to remember that vaccination is just one part of a comprehensive approach to tuberculosis prevention, which also includes screening, early diagnosis, and treatment. In summary, while the BCG vaccine is still used in many endemic regions, it has limitations, especially for adults. New vaccines are being developed to fill these gaps and could change how we prevent tuberculosis in the future. If you live in an area where tuberculosis is common, talking to your healthcare provider can help you understand your personal risk and whether vaccination is right for you. Always follow local health guidelines and recommendations to stay protected.